Hi and good evening, Dr. Nur Farizan. We are from group 9 that we going to present our article journal, which the title is the e-health biomedical instrumentation with Arduino. And here is our group member, which are me, Smaker Siam, and then Muhammad Safwan Azizi, Muhammad Zul Iman, and our fourth member is Nur Shafika, and the last one is Nur Shafni. And we are going to the first presenter.
Biomedical instrumentation involves creating tools and systems to measure and analyze physiology parameters and deliver treatments. Arduino, an open-source electronic platform, has made it practical and affordable to develop a wide range of biomedical solutions. Arduino microcontrollers are versatile and can connect to different sensors and transducers, allowing us to monitor vital signs and bioelectric signals. We can use sensors like pulse oximeter, temperature sensor, and electrode for measuring ECG signal. Arduino also let us integrate actuators like motors pump for tasks like drug delivery or prosthetics. Arduino open source nature is another reason it's popular in biomedical instrumentation. A large community of developers and enthusiasts has created many tool libraries and projects. This collaborative ecosystem makes it easier to develop and prototype biomedical devices quickly. Biomedical instrumentation with Arduino have diverse applications in biofeedback system, assistive technology, rehabilitation, and health monitoring. It enables the creation of affordable, portable, and user-friendly solutions that improve the quality of life for people with medical conditions, support research, and change healthcare.
The article discusses different types of sensors used in biomedical instrumentation. These sensors include temperature sensor, which measure the level of heat or coolness of an object or environment. Airflow sensors are used to measure the flow or velocity of air, while accelerometers measure acceleration forces and can be used to detect movement or vibrations. Galvanic skin response (GSR) sensor measure changes in skin conductance, providing insights into stress levels or emotional states. Oximeters measure oxygen saturation levels in the blood, and electromyographic (EMG) sensors measure the electrical activity generated during muscle contraction, which can be used in various applications such as assessing muscle performance or diagnosing neuromuscular disorder.
Next is measurement system element. The journal article provides a brief overview of the e-health sensor shield used in teaching biomedical concept. It introduces various sensors including temperature, airflow, accelerometer, GSR, and oximeter, which convert physical parameters into electrical signals. The journal article explains that sensors employ different physical concepts for detection. For computation are mentioned peak detection, signal processing, heart rate computation, and force calculation. For ECG signals, students extract heart peak to determine heart rate, while an algorithm is used to process longer segments. EMG signals are used to calculate force relative to MVC. The journal article mentions a real-time display of heart rate data through the serial console facilitated by the Arduino board connected to the sensor shield.
The article Biomedical Instrumentation with Arduino discusses the use of an electrocardiogram to measure a physical quantity called the measurand on the body surface. The measurand is the property or condition that the system is measuring. The ECG sensor converts the physical measure into an electrical output, and this conversion is performed by a transducer, which is a device that converts one form of energy to another. Figure 1 in this slide shows a signal conditioning component which is responsible for amplifying and filtering the signal from the sensor. It may also match the impedance of the sensor to the display, which is a computer. In this case, a microprocessor or specialized digital circuits are typically used to transform the sensor output into digital signal for further processing. Signal filtering is employed to eliminate unwanted sensor signal and can also transform data from the time domain to the frequency domain or average repeating signal to reduce noise. The measurement results need to be displayed in a format that can be easily perceived by a human operator. In the project described, a computer with specific specifications was used to display the results. Computers are widely accepted in the medical field for various tasks such as data collection, manipulation, processing, and serving as complete workstation for different applications. Based on the information provided in the article and this figure, the chosen component for the system include a display, data storage, data recording, and data transmission.
The measurement system captures and interprets psychological signal for health monitoring and biomedical research. Its components include sensor, a signal conditioning circuit, an analog to digital converter, microcontroller, displays, and wireless communication. Sensor measure vital parameters like temperature, pressure, EMG, and ECG. The signal conditioning circuit amplifies and filters the signal. The ADC converts analog signal to digital for process analysis. For processor process the data, display, show result, and wireless communication enables remote monitoring. Microcontroller process analyze signals, execute algorithm, and provide insight. Displays offer visual output for interpretation, aiding in monitoring and analysis. Wireless communication enables to remote monitoring and real-time insight in healthcare and biomedical research. The measurement system has application in EMG and ECG signal analysis. EMG involves amplifying and extracting features from muscle signal for tasks like gesture recognition and muscle fatigue assessment. ECG analysis include amplifying and detecting heart signal to assess heart rate and variability. Overall, the measurement system has revolutionized our understanding of the human body.
I want to talk the application about ECG and EMG. Arduino adaptability, affordability, and user-friendly interface make it an excellent platform for creating unique biomedical device. Let's start with ECG monitoring, which help track and identify heart issue. With Arduino, you can build a possible ECG monitoring system that record and analyze the electrical activity of the heart. Here's a simplified process. Attach ECG. The first one is attach ECG electrode to the patient chest. Amplify the filter the electrical signal using Arduino's instrumentation amplifier. The 3 is connect the amplified signal to Arduino analog input and convert it to a digital signal using a built-in ADC. The 4 is analyze the ECG waveform using digital signal processing technique. The last one is visualize the ECG waveform or computer screen or an LCD display. Let's talk about EMG. EMG has various applications in sports science, prosthetics, and muscle rehabilitation. Here's a simplified process for building an EMG measurement system with Arduino. The first one is apply EMG electrodes to the desired muscle or muscle group. Second is amplify the filter the EMG signal using Arduino instrument amplifier. 3 is connect the conditioned signal to Arduino analog input and convert it to a digital signal using the ADC. The 4 is analyze the EMG signal using signal processing technique like feature extraction and filtering. The last one is visualize the processed EMG data on a computer screen or an LCD display. For the conclusion, I want to highlight the remarkable benefits of biomedical instrumentation with Arduino. It offers an affordable and versatile approach to developing innovative solutions in medicine. Arduino flexibility allows us to integrate sensor and customize instrument for measuring and analyzing physiology parameter. What makes Arduino even more special is its open source nature with encouraged collaboration and grants access to a large community of developers. This community provides a wealth of knowledge and resource to biomedical engineers. With Arduino, they can design health monitoring devices, rehabilitation tools, and much more, ultimately improving healthcare delivery and enhancing patient outcomes. One of the significant advantages of Arduino is its affordability and accessibility, making it suitable for various applications. Biomedical engineers can leverage Arduino to create cost-effective solutions that benefit a wide range of individuals. Additionally, Arduino compatibility with emerging technologies open up possibilities for intelligent healthcare systems, where devices can communicate and share information seamlessly.
So that's all from us. Thank you.